Well, if all the tests are normal, that's great, but that's usually not the case. Usually we will find one or two things. The ENDPAT score, there's a study out of Mayo. If your score comes back, your RH4 hyperemia score is less than 1.67. There's a study done at Mayo that showed that if that score was under 1.67, there was a 49% rate of cardiovascular events in the next 7 years, which means those patients with the score, with a low RH score, 49% of them had a major cardiovascular event, either stroke or heart attack or death within the next 7 years. Carotid ultrasound test, usually we treat that with medication, preventive type things. If the blockage in the carotid artery is over 80%, they're usually referred on to cardiothoracic surgery to have that fixed. ABI mostly is an indicator of peripheral vascular disease. If their score is low, the ankle brachial index is low, then those patients, if you got blockage in your legs, you usually already have blockage here or here. So you just be more aggressive with those patients. You can reverse this, and I've been able to reverse a lot of these scores in a lot of my patients. The ENDPAT score is usually the endothelium arterial dysfunction is usually a matter of how much nitric oxide you have. That's really what kind of what it's measured. So you can increase the nitric oxide with L-arginine, with biastolate, which is a beta blocker that increases nitric oxide. As far as blockage in the carotid arteries or the legs, combination of a statin drug with niacin, that's been proven to reverse blockage in arteries. Fairly new study. You can see reversal within 3 to 6 months. We've seen that with our patients. Arterial age, I've had people come in at 72, the arterial age is 88, put them on niacin and statin, and come back and the arterial age is 48.